Namaskar. First and foremost, I would like to thank Mr. Radhakrishnan Das for inviting me, for reaching out to me, and inviting me for this presentation. It's my honor to be here. Thank you, UIS Cancer Foundation, and thank you, Kalikoti University, for the kind invitation. So before I start off with my formal presentation, I just want to brief a little bit about the scenario that has, motivated me to start the Foundation Breast Cancer Hub. So being a cancer research professor over the years, I've realized how lives are lost to breast cancer or to other types of cancers because of taboo, ignorance, lack of awareness leading to late detection, inaccessibility to healthcare facilities, and proper treatment and medical guidance. So all these concerns motivated me in 2017 to start Breast Cancer Hub as a full-time pro bono voluntary humanitarian service to bridge the gap between the developed and developing world with 100% free services. So everything we do is 100% free, and whatever donations we receive goes for the cause and for the mission. So, without further delay, this I would like to bring to you the reason why I'm here to talk a little bit about the early detection and prevention, but in a very nutshell, because I think I have 20 minutes to present. So I just want to make sure that I covered the highlights. And after that, if you have any questions, you can please reach out to me at lopa@breastcancerhub.org. So I always start with the tribute. So I'm going to walk you through in the beginning with the breast cancer screening and why it is important. So here you see the two young women we lost in 2018 and 2020. And when we think of Lotika Das from Guwahati, and basically her diagnosis itself was late. So when she was asked like what happened, she knew that she did not even realize that she did not know that a lump in the breast could be cancer. And we lost her because when I saw her reports in 2018 January, it was already stage 4. Stage 4 means the metastasis, that means the cancer has spread from the breast to the distant organ. Similarly, with in Mumbai, we had Manjeet Kaur, and she was also diagnosed at last stage 4, and unfortunately, we lost her. So they are my inspiration. What I want to tell you is that irrespective of socioeconomic condition, irrespective of education, women are dying to breast cancer because of the late detection, and that happens because women are not doing the proper screening protocol. Screening means when we do not have any symptoms, we are doing the examination. So the problem is that women are going to the doctor when already the cancer has become big, the tumor is big, or it has metastasized to the distant organs. Because with breast cancer, the stages are stage 0, stage 1, stage 2, stage 3, stage 4. So from stage 0 to stage 3, we can actually cure the patient, and but then the more quicker we diagnose, the better the prognosis is, the better the treatment protocol is, and it is much easier to cure. So it's important to diagnose early. Similarly, we are not much aware that men get breast cancer too. With men, the scenario is worse than women, and men feel it's a woman's disease and they're more shy to talk about it. So that's the reason why whenever I am talking about breast cancer, I try to bring in all genders for women, men, and LGBTQ plus too. So wherever I'm from now onwards, the screening protocol that I'm going to talk about will involve the men and the LGBTQ plus and also the women. So it is inclusive of all genders. So I want to show you the picture of this car where we have Marlin Washburn, and Marlin was fighting for breast cancer for his daughter, but he had no idea that he also had breast cancer. And when diagnosed, it was already too late, and he was a principal in the school. Similarly, we have this group of men over here who are either breast cancer fighters or survivors. So like I was in Chennai in doing one of the community outreaches in 2019, and one man came to me after my session and told me, "Can you please touch the nipple area under my breast?" And I could feel a lump, and I was surprised. I said, "You came for my session because you could feel a lump in your breast?" And he said, "No, I came because my sister is going through breast cancer." So what I want to tell everyone is, if you know anyone in your family going through breast cancer or any other or ovarian cancer, please please do not, the men should not ignore themselves, because men are also predisposed for certain genetic mutation which the men can carry, and then they can not only have breast cancer but prostate cancer, digestive tract cancer, and other type of cancer. So I'll touch base a little bit about it afterwards. Now, what is the statistics, right? So this is the scenario. This many deaths we are expecting in the US, but in the developing world, the death rate is significantly higher compared to the developed world, especially in our country, India, because of the taboo, ignorance leading to late stage detection, and also the lack of research, because the true representation of the data is not being reflected. And we just have data from few repositories, but actually in the real scenario, there are many more deaths than what is represented from the nation. Now, what exactly is early detection, right? Because breast cancer, when detected early and treated correctly, is curable. So, what is the screening process? So, screening means when we do not have, as I said earlier, when we do not have any concerns in the breast, at that time we are going for the screening. That means the examination. So the protocol is that when we reach the age of 40, we have to go for a screening mammogram. Mammogram means X-ray of the breast. Now, when we go for a mammogram, so every year we should be doing it. But unfortunately, younger women are also getting breast cancer, or in all genders. So what do? We have to go for clinical breast exam. Clinical breast exam means when the doctor is examining our breast. So whenever we go to a doctor for a yearly health checkup, please request your gynecologist or your healthcare physician to do your clinical breast exam. On the contrary, in addition to all of that, we also have to do the breast self examination every month. And I'm going to teach you the protocol how to do it. But before going into that, I want to bring to your attention a very important like a very important topic which is missed out even in the US. Now, as you know that mammogram, which is the gold standard for breast cancer screening, did you know that mammograms can also miss cancer? And something similar like that has happened with Dr. Nancy Capello. When she went for her mammogram many years back, she was diagnosed as that, there's no tumor, no cancer. But when she went for her clinical breast exam, doctor felt her lump and it was diagnosed as stage 3 breast cancer. So she was shocked, So what happened? So what actually happens? Why mammograms can miss cancer? Because of dense breast or fibroglandular tissue. Now, what happens is that our breast tissues are made up of, usually supposed to be made up of fatty tissue. When it is fatty tissue, it appears as a black background. But when we have dense breast or fibroglandular tissue, it appears as white patches. And when we have cancer or tumor, it appears as a white dot. So it's basically, this will be lost in the white background, and that's why the cancer can get missed. So what do we do? So in the US now, the regular mammogram has become redundant. We are recommending to do 3D mammogram or tomosynthesis, which is a higher resolution and a better kind of mammogram. Now, in India, not all the hospitals will be having the 3D mammogram. So what we tell everyone is that please go for the regular mammogram, but in addition, please ask your doctor if we need an ultrasound or a sonography to be done. So which is the protocol, So, and in India is much easier. So please go ahead with your sonography or ultrasound in addition to mammogram, after the age of 40. But if you are at a high risk, if you have a family history, then you should go for the screening mammogram or ultrasound and sonography much earlier than the recommended age. Now, next is that even when we go for the screening mammogram, we have to do a breast self-examination every month. And it starts from the age of 17 or 18, and for the first time, we have it for women and for men, and we have it from Breast Cancer Hub in 24 languages. So we have it in Uriya also. Please download the Uriya language. We have it in Hindi, Bengali, Assamese, in Tamil, Telugu, different languages, Indian languages, and everything done, a translation done by our volunteers from scratch, actually. So not from Google Translation. So these are all available in this website. So if you go to breastcancerhub.org, if you copy this link, you will find all the different languages. Please download the language of your choice and spread it in your network, like how to do the breast self examination. What is the correct protocol? So it is not that we suddenly remembered and we will do the breast self examination, right? So we have to pick a date in the month for the men and the postmenopausal women. And for the women who have the period cycle, we have to do it 7 days post menstrual cycle. For example, if our period starts today, it is 1, 2, 3, 4, 5, 6, 7 on the 7th day. So how to do it? Now, because before period or during the period, there are many hormonal changes going on. So we always recommend 7 days from the start of the menstrual cycle. Now, how to do it? We take our hand behind our head and look for any signs or symptoms. For example, any swelling of the breast or any skin irritation or the nipple inverted suddenly, or the freckles around the nipple, like khush around the nipple, like the orange skin, or there is any discharge from the nipple, bloody discharge, translucent, transparent discharge other than breast milk, and then redness or scaliness or thickening of the nipple or the breast area. So any abnormality, please, if it is a sudden change, that means when so from the age of 17 or 18, we have to do a breast self examination every month, because if we have to understand the look and feel of our breast to detect any abnormality. Now, next is that we put our hand behind our head, and in a sitting position or sleeping position, we try to check our breast from the collarbone area, and also the underarm area. So it's basically we have to check the full breast rather than only full chest area rather than just the breast area. So when we go from top to bottom, we have to look for any lump, like anything like a hard, like a marble. It slips in our finger. It may be painless, it may be painful. Irrespective of being painless or painful, if it doesn't go away for in few days, we immediately go to the doctor and we do the screening mammogram or like ultrasound in addition. So this is the protocol, and this is so important because this is a life savior. Because if you see this girl over here, she had the aggressive type of breast cancer at the age of 25. But what saved her life is breast self examination. And the reason why I'm bringing her story is that she is an inspiration, because many times we feel that we cannot talk about breast cancer or we cannot get married. So her marriage was fixed during the time of her chemo, because her marriage was already fixed, and then she was detected with breast cancer, and she was like, okay, I'm going through my chemo. What do I do? It's my marriage fixed time. So she got married during her chemotherapy. She finished her treatment, and now she has a beautiful baby. So what I'm trying to say is, if we follow the protocol, if we follow the screening process diligently, cancer is curable. Only thing is we have to detect the cancer early. And so I've told you all the ways how we can detect breast cancer early. Now, I want to talk a little bit. I don't have much time, I know. Just a little bit touch base on the other two types of cancers that Dr. Radhakrishnan has mentioned to me. So there are, if I go into different cancers, it's like it will take me the whole day. But I want to bring to you that we have developed early detection cards for other types of cancers too. So it is all on our website. Please download and leverage and share with your network. But I want to bring up two types of cancers that is very prevalent in our Northeast India. One is in our Northeast India, and also in Orissa and in Bhubaneswar too, right? Because I know I have been to Bhubaneswar, I've been to Orissa, so I know the situation over here, and also like Northeast India, compared to South India, this is the capital for cancer because of the intake of tobacco, the chewing tobacco. Now, I know that the similar situation is also probably there in Bhubaneswar, in Bahrampur, and in Orissa, different areas in Orissa, right? So what happens is that how do we examine for the signs and symptoms of oral cancer? So I always say that please go to a dentist for dental hygiene examination. We should not be waiting that for the lesion to be so disturbing and painful that it progresses. So we can do our self oral cancer screening, as I have shown over here. I'm not going to the detail because of time constraint, but if you see an irremovable white patch, if you see a white patch which is irremovable, or a red ulcer, or a red and white patch, or any ulcer or tissue growth within the mouth, some discoloration, or anything abnormal that is not going away for 2 weeks. If it is extending for 2 weeks, immediately please go to the dentist, because it is very, very important. So this is how you can actually inspect your gums, you can analyze your tongue, you can analyze the roof of your mouth for any abnormality. Another important thing is how to prevent oral cancer. Definitely the tobacco chewing or smoking tobacco or any betel quid, jarda, supari, all of this, tuna. So these things we need to stop. Even alcohol consumption, and also that, excessive sun exposure to the lips can be also a trigger factor. And we need to visit our doctor regularly. We have to have a healthy diet. We have to go with the oral hygiene. And also because HPV, human papilloma virus, can be also one of the reasons. So it's good to get vaccinated against the HPV virus. So this is just in a nutshell about oral cancer. I want to a little bit brief also about the colorectal cancer, the colon and the rectal cancer. And you can see here that many times in our country, we are seeing that even in the US, we are missing on the colorectal cancer because we misthink it to be like, for example, hemorrhoids or the piles bleeding. And we just let it go for for months. So anything like any constant or increased rectal bleeding, it can be overlooked for fissures, for piles, for hemorrhoids, for constipation, but we should not ignore that. Then anything like when our stool is like narrow, pencil like, or there is some bloody discharge within the stool that you are seeing, any tarry or black or bright red, or sometimes that can be occult also. It can be hidden also. So that becomes a warning sign. So there's something about like the persistent incomplete bowel movement. If our bowel movement is not happening properly, there's a bloating, there's gas, there's cramp, nausea all the time, you're having the back pain, pelvic pain, and also, many times you feel like eating, but you are not hungry. Like, you're like the moment you eat a little bit, you are full, or you are hungry, but you're not feeling. So some abnormalities going on within your digestion. At that time, please report to the doctor. It's very important that we also do the screening colonoscopy. We also have a Cologuard in the US, but I'm not sure if it's available there. But after the age of 45, we recommend that we go for screening colonoscopy. And if there are no polyps or anything, then we come back in 10 years or 5 years. So it depends upon the situation. So it's important that please go for the colon cancer, colorectal cancer screening. Similarly, with stomach cancer, also is pretty much, it is being detected late most of the times. And all these cancers are also connected to tobacco, to unhealthy lifestyle, to the food that we are eating. So with the stomach cancer, the symptoms are mostly like, blood can be in the stool, or there'll be tiredness or fatigue, or the stomach will be swollen, or there will be like stomach acidity and heartburn. And most of the times with all of this, we just go and take antacid. We just ignore. And family history can be also the reason. 5 to 10% of all cancers can be for family history. So what do we do when we have this kind of symptoms for long? We definitely need to go to the doctor, and because endoscopy is recommended. So the reasons why I'm saying these three cancers, because I can go on with other cancers too, but because that many times these cancers are being missed, thinking that these are just normal signs of indigestion, so, or like other symptoms like, what we have with diarrhea, constipation. So please make a rule that, if something, your discomfort is happening for more than 14 days or 2 weeks, please visit the doctor immediately and do the proper imaging screening rather than just having medication. So we have to go to the root cause of why this is happening. Now, this was all about the three types of cancers, or 4 types. I wanted to bring it up to you, but just in a nutshell, I also wanted to talk a little bit about prevention. The number one preventative measure is tobacco. I'm doing an anti-tobacco campaign, so please, please, I'm requesting everyone present here to not touch any form of tobacco. Like I know it's our culture to give pan. With pan, we are not just eating pan; we are mixing all different harmful ingredients, right? So tobacco is the leading cause of preventable death. Then alcohol. Alcohol consumption also leads to underlying inflammation. That is also should not be made a habit. Similarly, the overweight or the being overweight is connected to inflammation. Then inflammation is an underlying factor too. Any form of inflammation or chronic disease that causes inflammation can be a trigger factor. So always remember to curtail or the inflammation within our body. Then the environment we are living, the radiation, UV environment, occupational hazard. Are we working in a factory where we are consuming, inhaling gaseous things, smoke all the time? So we have to be very vigilant about the environment we are working. Similarly, our race and ethnicity plays a role, right? So we belong to different community, different genes. Like family history is very important. 5 to 10% of cancers are inherited with family history. For example, with breast cancer, there is called BRCA mutation. So we have to know that if in a family is ovarian or breast cancer, we have to make sure that the genetic testing is done, and it should be done in both the males and females and offspring for all genders. So similarly, for other cancers also, besides, for example, colon cancer, we can check for the Lynch syndrome. But apart from that, but that is only 5 to 10%. But the lifestyle, the environment plays a significant role. The stress plays a significant role. Is an upregulation for different type of oncogenic signaling pathway. Similarly, certain hormone therapies, we have to be very sure that we, at the postmenopausal women, the hormone replacement therapy, that can be also a future risk. And most importantly, like doing exercise, because our sedentary habit has now become a very major problem. Like we need to do exercise, because exercise helps to boost the immune system in addition to proper food, because antioxidant rich food, because there are free radicals in the body which will go and damage the DNA of the cells, leading to the uncontrolled cell division. So we have to really provide antioxidant, because that will balance the electron, the electron will balance the free radical, and it will not no longer be available to go and damage the DNA. So good healthy food, lot of fruits and vegetables, is very important. And reducing the amount of meat that we eat is significant for our diet, because these are all interconnected. Development of cancer is not a one-day thing. It's over the years this can happen. There's a damage to the body constantly, but there are repair mechanisms also. And by providing a healthy environment, healthy lifestyle, doing meditation, stress, putting everything together, the environment, all this together will really help with the prevention, of the cancer. Or even if we have cancer, but with a healthy lifestyle, the response to the treatment will be better. So this is so important. And what are we doing in India? I've been working since rigorously, going and doing community outreaches, providing all the support with the breast self exam cards with all languages, but also taking accountability. So because anyone needing any help can reach out to me, and I'll try to navigate and help with the next steps. Similarly, we have adopted villages. We are going door to door, and like all the suspicious cases for all cancers, we take them to the hospital, because for them, food is the priority and there's no one to accompany them. Our team takes care. We will be there with them. We will bring them home. We will make sure they're following up. They're going back for the treatment. So it's a sustainable mode that we created. And I can't tell you, I feel so proud of, we have adopted from 1 villages. Now we have adopted 18 villages actually. So basically it's a very, very successful model, but most importantly, is the happiness, that we get by saving those lives who would have totally gone undetected. Similarly, we have support groups. We have a very private WhatsApp group. If anyone going through cancer can reach out to you, and I'll try to help and guide in every possible way. So these are the simple, not simple, I would say it's like 24 hours is less for me. But what I'm trying to say is cancer journey is not about just early detection, not about just screening. If detected, it's the full process, we have to hold their hands as a community, because when someone's detected, the family is shaking. So everyone from everywhere needs to support, even to give a meal, like a hot food to the family when they're in the hospital. That is also a help. Everything doesn't have to be a medical help. The emotional help, supporting by giving meals, giving hot food to the family, being there for them, just giving a hug at times works like magic. So this is what I think we should all be doing, that when we are doing an awareness session, it should be a compilation of different aspects, because it's just not about awareness, it's about walking the person through the journey and holding their hands. That is that, and not only holding the hand of the patient, but also the caregivers. That is equally important. So saying that, I would like to wrap up, because I just hope that I wrapped it up on time. And when I started Breast Cancer Hub, a lot of people ask me, like, how do you differentiate? And I always say that, why do I have to differentiate? Because we are fighting for the bigger cause, the cause of cancer. Why can't we come together? And that's why our tagline is "Together we save lives." And saying that, I can't be more thankful to Mr. Radhakrishna Das, the UIS Cancer Foundation Charitable Trust at Bhubaneswar, and the Kalikote University at Behrampur for the kind invitation. I remember I met many of you from the UIS Cancer Foundation. You were there with me. I did a in-person session, and I can't forget those moments, because for me, I also met Mr. Radhakrishnan in Bangalore. For me, the relationship that we grow together for the fight of cancer, but also, as we come together, that is equally important. So thank you so much for inviting me today, and it's an honor to be here. So saying that, I would like to really, really appreciate and congratulate everyone from who the organizers are, the UIS Cancer Foundation and Kalikoti University, for standing up for the fight of cancer and doing this awareness sessions, the conference, and I cannot be more proud. I'm sorry I'm missing it in person, but I hope that the message that I have given, it will be translated to the families and everyone present here. Please download, please go for screening, please make your family, execute whatever I'm saying. Then only our mission together will be accomplished. Thank you so much. Namaskar.